Hi, it's Dr. Paul. I've had a patient ask me recently to talk about when is asthma an emergency. You see, if your child has asthma, in fact, if you're a parent or anybody who has asthma, there comes a point where you're wondering, do I need to go to the emergency room or not? And it's always a judgment call. How do you know? Well, I'm going to try to address that. First of all, I think it's helpful to understand what's going on with asthma. And with asthma, you've got two things going on. First, there's a trigger that causes spasm in the muscles that are around the tiny airways, bronchospasm, and they narrow so you can't move air. So obviously it's a matter of how tight they're spasming, whether or not you're in real trouble or not. So we have a situation where, let's say it's triggered by a huge dose of an allergen that you're really allergic to. Maybe it's cats. Let's just use that as an example. Or Timothy grass here in Oregon, and you're out on a windy, dusty day and you just start wheezing like crazy. And you're struggling to breathe. I get this with exercise. Some people get exercise-induced asthma. I'll forget to use my inhaler, which I need to use prior to intense exercise, and I can barely run. In fact, I'll be wheezing walking when it gets severe. But how do you know if it's time to go to the emergency room? It's a matter of how constricted those airways are. So there's definitely a point at which they're so constricted that you're turning blue. We don't want to wait until you get to that point, okay? So it's a matter of determining, are you so compromised that you're about to go into absolute respiratory failure where your airways shut down so tight you can't move air at all? We never want to wait to that point because, folks, asthma in rare situations can kill you. You let the airways get so tight that even with breathing treatments, there's not enough air moving to get the medicine down into the lungs. I want to illustrate something. So this is an inhaler, and we usually, if you have asthma, you have an albuterol inhaler. There's several brands. I just grabbed one. So imagine if I'm having an asthma attack, and those of you with asthma, you have an inhaler. I just grabbed one. Albuterol, there's different brands. And the key is getting the medicine into your lungs, because if you can't get the medicine into your lungs, it's not going to help. So I'll illustrate what you're supposed to do. Breathe all the way out. And then hold it. You hold that medicine as long as you can, and usually you take 2 puffs. And just doing that, if you have enough airflow, will usually make a huge difference. Now imagine, however, I'm breathing super fast. I've let my asthma get so bad that I'm now... It's not getting there. That medicine's going to go up and down the trachea and just aerate the tubes. It's not getting down to where I need to be. So if your child's already in that severe of a state, if they're a young child, they're breathing over 60 breaths per minute, you got to get into the emergency room, office, get in quick. If you're an older child and you're starting to feel panicky, you've got to get in right away. If you're an old enough child to do what's called a peak flow, this is just one example of a peak flow meter, you move the little dial to the bottom, take a big breath, you blow as hard and fast as you can, and you can measure your peak flow. And we have inhalers for adults. These go all the way up to 800. This one for children goes up to 400. And there are normals for what your peak flow is supposed to be. I'm going to show you an example of normals that's based on the height. So you'll notice there's a height along the left, and then I think you've got an 80% and 100% column on the right. You want to be above 80% of what your normal is based on your height. Now, for most children, even school-age children, it's recommended you use some form of a chamber because it's very hard. And this is true actually of any age. If you're starting to breathe that rapid, shallow breaths, you can put your inhaler into this device, and there's several different types. Notice I can breathe into the device and out, and there's a little valve. This allows those people who are breathing fast I don't want to keep taking on this albuterol, I'll get jittery. But you get the idea. So it's highly advisable to use a spacer. And then finally, and we're talking about should I go to the emergency room or not? If you have your inhaler and a spacer, you're going to do 2 puffs of albuterol. Usually your prescription will say 2 puffs every 4 hours as needed. Well, let's say you know your child's breathing way faster than normal. This is definitely an asthma attack. You've seen this before. You give the 2 puffs and nothing's happened. It's 5-10 minutes later, nothing's happened. Go ahead and do it again, because they're just doing that shallow breathing and it's not getting there. You can do it again a couple times. You can't keep doing it when you're not wheezing, which is why I stopped, because too much of this medicine when you don't need it gives you a very high heart rate, and that can be bad for you. But I wanted to point out a nebulizer. So I just hooked up a little nebulizer here. Makes a lot of noise. I'm going to turn it off so you don't have to hear the noise. But if you have one of these, you put your albuterol in the cup, and if you have a small child or even an older child who you want to just breathe in like this, so you turn it on, and that process takes about 5-10 minutes of constant, slowly inhaling the albuterol. Sometimes in the more severe cases, when you go into the emergency room or our urgent care, we'll use this for people who don't have a machine at home, because eventually some of that medicine gets down into the lungs where it needed to be to open up those airways. So that's the advantage of a machine in the severe asthma situation. You just do the breathing treatment until they start opening up. Couple other things I just want to mention. So you can measure peak flow if you're less than 50% of what you're supposed to be, and you've taken a couple treatments at home and you're still less than 50% of where you're supposed to be. Remember that chart I showed you? You need to get in and be seen right away. Obviously go in if you're panicking because of shortness of breath. And finally, there's one other device that can be very helpful, and it's now actually affordable, a pulse ox. Those of you who have children who have frequent asthma attacks, you may want to invest in a small portable pulse ox, and that way you can actually check the oxygenation of your child's blood with just putting this on their finger. And I'm going to demonstrate this for you in a second. These are quite affordable. It's a little Quest oximeter. This technology wasn't available a few years ago, folks. This is so incredible. So you just stick your finger in there and it's reading my oxygenation. We'll see if I'm living, what kind of shape I'm in. 96. Oh, wow. So my heart rate's 73. That's because I took all those inhalers. I normally run, when I'm just casual like this, probably in the 50s. But those inhalers, albuterol, constricts the blood vessels and it causes my heart to work a little harder. 73 is still fine. But you can see 95, 96, that's okay. I should be around 97 to 100, which is considered normal. Maybe the albuterol is affecting that. There's slightly more sophisticated ones for little babies where you have a little tiny probe, because the adult ones won't work as well, and you can read the pulse ox. We do this when little babies come in and they're wheezing. If you have this technology and you have the ability to check oxygenation, if your oxygenation is in the low 90s, especially if it's 90 or lower, you got to get to the office, the urgent care, the emergency room immediately. Give a couple treatments and just take your child. If you're 95 or above, even 94, maybe even 93, depending on how they're doing, you're okay to manage this at home, keep track of it, pay close attention, and make sure that they have their treatments going. You need your albuterol, which relaxes the smooth muscle around the airways, and you need your inhaled steroid as well. For those of you who have moderate to severe asthma and you already have a prescription of a steroid like prednisone, this would be an indication to take your steroid if you're getting down to that 50% of where you're normally supposed to be on a peak flow, or your saturations are getting down in the low 90s. That was a lot of technology. Sorry to throw that all at you. I did want you to get a feel for the tools that are available. The bottom line is, if you're struggling to breathe, you're struggling for air, you're feeling panicky, even without this technology, go get yourself evaluated. We can listen, we can do a pulse ox, we can do treatments until we get you out of trouble. And I very, very, very rarely have to send a child, even a severe wheezing episode, to the hospital for admission, because we can check oxygenation, we can give multiple treatments in the office or urgent care, and get you moving air well enough that you can manage this at home. Thanks for watching. I'm Dr. Paul. Hi, it's Dr. Paul. Ask your pediatrician.